Hi, I'm Marvina Halton, and today I will be talking to you about opioid overdose prevention. And I will also be giving you a demonstration on how to administer naloxone or Narcan to reverse an overdose. I am with the Drug Overdose Prevention Program at Egyptian Health Department. And just as a slight overview of what today's training will consist of, I will be discussing the opioid crisis as it relates to the opioid crisis in Illinois and the United States as a whole. I will be presenting some facts regarding the opioid crisis, solutions, legislation, and also what opioids are, how they work, what the risk factors for an opioid overdose are, and the signs and symptoms of an opioid overdose, how to respond to an opioid overdose using naloxone or Narcan nasal spray. Okay, so just a few data from the CDC. The CDC reported that in the United States in 2015, opioid-related overdose deaths were at about 33, a little over 33,000 in the United States, and in Illinois it was over 1,400. 2016, 42,000, and in the United States, and 2016 in Illinois, over 1,900. If you'll notice on this chart, I'm sorry, you guys, I know that you can probably hear that, but I live right near a train track. So, and it would come when I'm doing this training. Okay, so if you'll notice the trends in these numbers between 2015 and 2019, you can see that continual fluctuation. With the exception of 2019, it did drop down just a little bit. Okay, what you're looking at on the screen is two maps. The one on the left is the number of opioid overdose deaths in 2016 in Illinois by county. The darker the shade of the county represents the more deaths in that county. Okay, on the right, it's the same thing, except that they used a formulation per capita to compare it to the number of people in the population number in a particular county with regards to the overdose deaths and the numbers. It looks different. You can see there's more dark spots in the map on the left, and that's because when you look at things compared to county sizes, it changes it. For one, us here in Southern Illinois, our counties are less populated with people with regards to some of the counties up north, the larger counties. And these two maps, the one on the left represents the number of times EMS reported in 2015. They reported the number of times that they had to be called to a location and administer Narcan or naloxone. And when you look on the right, same thing, except again, they used a measurement per capita, looking at per 10,000 people in a county. Okay, some more opioid crisis facts. 1.5 times more number of people died from an opioid overdose than the number of people who died um, in homicides, and double the number of people died from opioid overdose than people who died in fatal car accidents. Over 30% more people died from an opioid overdose than the number of all gun-related deaths. That's homicides, suicides, and accidental shootings. And drug overdoses are the leading cause of deaths for people under the age of 50 in the United States. According to SAMHSA, over 200,000 people aged 12 years or older used heroin for the first time within the last 12 months. And in 2016, more people died from an opioid overdose than American lives lost in the Vietnam War. And that was when I was putting this slide together, that was one of the statistics that really just like gave me a realization of just how huge this crisis was. I mean, again, More people died from an opioid overdose than the number of American lives lost in the Vietnam War. That says quite a bit to me. Okay, in 2017, opioid overdoses killed over 2,200 people in the state of Illinois. And in the last several years in Illinois, deaths attributed to synthetic opioids increased tenfold. Synthetics would be fentanyl and also carfentanil. Now, fentanyl can be 1,000 times more poisonous than heroin, and it's usually used when maybe, cancer patients, people who are on hospice or who have had surgery. However, carfentanil was actually never intended for human consumption. Carfentanil is actually a tranquilizer for large animals. On the screen, what you'll see is the grains of salt. This would be considered a lethal dose of carfentanil. It literally looks like grains of salt. 2 milligrams is enough for someone to die. Okay, fentanyl was deemed the deadliest drug in America by the CDC. Between 2011 and 2016, deaths skyrocketed more than 1,000%. The largest rate was among young adults aged 15 to 34, which is a large reason why I also do this presentation at schools and places where young adults or teenagers and that sort are. So I will say this, if you know of any schools or any community programs or any other organizations that might benefit from this training and benefit from receiving the free Narcan kits that our agency offers, please do not hesitate to contact me. You can contact me by phone or email, and I will take this training wherever it is needed. Okay, so what has Illinois done in response to the opioid crisis? On the screen, there is I like to call it a map, and I usually start at the bottom of it. So, Illinois, one thing that they did was they enacted the Drug Overdose Prevention Law of 2010. And what this law does is it basically empowers friends and family to be able to administer the reversal drug Narcan or naloxone in order to prevent a fatal overdose. And in that, they're able to do that regardless of their presence or absence of a medical background. So anybody can receive this training, anybody can receive Narcan kits, and anybody can administer Narcan. The next thing that Illinois has done is they enacted the Emergency Medical Services Access Law, which is also known as the Illinois Good Samaritan Law. In an upcoming slide, I'll give you a more detail about what that law is because it is important. Then Illinois also enacted the Heroin Crisis Act of 2015, which grants access to naloxone. It strengthened the Illinois PMP program, which is the Illinois Prescription Monitoring Program. PMP is a program, basically the way that I break it down or just look at it simply put, it's the Illinois Prescription Monitoring Program, which it just allows, it's a network system. Anytime anyone goes to a pharmacy to get their opioid prescription filled or to a hospital or anywhere like that, doctor's office, those providers will enter the patient's name into a database, the PMP database, and it just alerts providers other places that this person has received a prescription. This cuts down on people doing what's called doctor shopping. Okay. And then the other thing that Illinois did is enacted the opioid STR grant of 2017, which also provides federal dollars and funds to a variety of education programs like this one, also treatment programs and prevention programs to address this crisis. Something else that was able to provide some funding for this particular crisis is the state opioid response grant. Okay, and speaking about the Illinois Good Samaritan Law, in 2012, Illinois again passed that act. And what it was, it protects people from drug possession charges if they witness or experience an overdose and call 911. So what we found is that um, you might have two people together using, one overdoses and the other gets scared of legal implications and they run off without providing the other person getting them help. So this law helped to cut down on that. Also, it applies basically good faith efforts made to seek emergency help, okay? Whether it's calling 911 or taking the overdose victim to the ER and not just dumping them outside or leaving them in a car and taking off. Since this law was enacted, we have seen a 9 to 11% decrease in overdose fatalities. Okay. What are opioids? Opioids are a type of drug that come in both legal and illegal forms. Some of the legal prescription form would be the prescription, some of the prescription medications such as oxys, hydros, morphine, fentanyl, and some of the illegal forms would be, of course, heroin. Opioids are a natural or synthetic substance that act on the brain, and the attraction to them is that they dull pain and relieve anxiety. These are some more on the screen, some more common types of opiate and opioid painkillers. So how do opioids work? So your brain, on the screen, I have a picture of opioid receptors on the brain. So your brain has many receptors. What happens is when a person takes an opioid, it comes in, the opioid comes into the system and it rests on those brain receptors and slows down the person's breathing or stopping the breathing if they've taken too much. Okay, an overdose also occurs when the body is taken over by any toxic amount of a substance or a combination of substance. And anyone can overdose regardless of their substance use. So some of the people who are at risk, and those risk factors are an individual's tolerance, what was taken, whether they mixed substances. A lot of times when people are using illicit drugs, they're also drinking and using alcohol. Opioid slows down the breathing and alcohol slows down the breathing as well. So when those two are combined, they can become deadly. Also a person's individual's overall health plays a role, and a person's history of drug abuse, and the variation and content basically of a street drug, basically meaning what a drug was cut with can play a role. And we talked about in the previous slide that fentanyl and carfentanil, that they are both very deadly. So a lot of times people are cutting heroin with those two substances. People who are at a higher risk for an overdose are people who doctor shop, people who use opioid prescriptions that belong to others, and people who inject drugs for a greater effect, people who switch between opioids, and also people who have recently completed a treatment program or who have been released from jail. And that's because the user does not take into account that once they've been away from a drug for any amount of time, that their tolerance level changes. And when they go back to that drug or relapse, they often try and use the same amount that they were able to use before they went into treatment or were incarcerated. And a lot of times they will overdose. Also, people who were recently discharged from emergency medical care after an opioid overdose, and that's for the same reasons. When someone overdoses and goes to the ER, their system is basically cleansed of the substance. And so when they get out of the hospital, oftentimes they go right back and use again, and they can overdose because it doesn't take very long for your tolerance level to change. And also, people who are at a higher risk, again, are people who are intoxicated for the reasons that I explained earlier as to how opioids work and alcohol. Okay, so if you happen upon someone and you're trying to determine if they're over medicated or really high versus are they actually overdosing, some things you're going to look for when someone is over medicated or really high is their muscles will become relaxed, their speech is slowed and slurred. They might have that sleepy look, they might be nodding, but however, they will still respond to stimulation, like yelling or rubbing, and put your hands in a knuckle and rubbing down their sternum bone, pinching them. When we say yelling, we mean like shaking them and calling their, nudging them and calling their name. So if they're high, if they're just really high, they will usually respond to that. Now, if someone is actually overdosing, some things that you will notice, they may have that deep snoring or gurgling noise, also known as a death rattle. They will have very infrequent breathing, or they may not be breathing at all. They will be pale and their skin will be clammy. They will be nodding really heavily, but they will not respond to stimulation. Again, if you perform the sternum rub, putting your hands in a fist or knuckle position and rubbing those knuckles down their chest bone, that's pretty uncomfortable. So if you do that and they still do not respond, chances are that they are overdosing. Also, something you will notice, they will have a slow heartbeat and pulse. Some other signs and symptoms of an opioid overdose. And again, you might notice that I repeat some things. That's because those things are important. Okay, so again, signs and symptoms of an opioid overdose might be pinpointed eye pupils, slowed or stopped breathing, unconsciousness, non-responsiveness, limp body. Their skin or face again might be pale and clammy. Sorry. They may have purple or bluish colored lips or fingernails. They might be vomiting or have that choking or gurgling noise, again known as the death rattle, and also respiratory depression. When responding to an overdose, the 5 main steps you want to remember are step 1, call 911 for help and say to the 911 operator, I'm with someone and I think that they might be overdosing, and give a clear and accurate description of your location. Step 2, check for the signs and symptoms of an opioid overdose, also giving the sternum rub on the sternum, and you can also take that same fist that you have made to do the sternum rub and rub across their forehead and calling their name. And again, those are some checking for the signs of an opioid overdose are the steps that I talked about on the previous slide. Step 3, you want to support the person's breathing. Step 4, you want to administer naloxone. And step 5, you want to monitor the person's response and continue rescue breathing if they have not responded after about 2 to 3 minutes. You want to administer a second dose of naloxone, and that's because you may need a second dose because you don't know what they've taken or how much of it. How to perform rescue breathing, I will show a short video clip.
In this portion of the Pharmacy Pearls Opioid Overdose Education video series, we're looking at how to respond to an opioid overdose. Previously, we stressed the importance of calling 911 for help. Now we'll focus on performing rescue breathing. For a person who is not breathing, rescue breathing is an important step in preventing an overdose death. When someone has stopped breathing and is unresponsive, rescue breathing should be done as soon as possible because it is the quickest way to get oxygen into the body. Steps for rescue breathing are: place the person on his or her back and pinch their nose. Tilt the chin up to open the airway. Check to see if there is anything in the mouth blocking the airway. If so, remove it. Give 2 slow breaths, blowing enough air into the lungs to make the chest rise. Turn your head after each breath to ensure that the chest is rising and falling. If it doesn't work, tilt the victim's head back more. Breathe again every 5 seconds. When performing rescue breathing, you can use a CPR mask or mouth barrier containing a one-way filter valve to protect yourself from the victim's potentially infectious bodily substances such as vomit or blood. Finally, rescue breathing should be continued until the person can breathe for themselves or until help arrives. Thanks for watching. Please stay tuned for the next edition of the Pharmacy Pearls Opioid.
Okay, so a little bit about naloxone and Narcan. Naloxone is a medication approved by the Food and Drug Administration to prevent overdoses by opioids. And also there is a standing order on naloxone or Narcan in the state of Illinois, which just means no prescription is required. You can walk into any pharmacy that sells it and buy it right over the counter. And then now you can also use your medical card or insurance to purchase naloxone or Narcan. If you go to a pharmacy that does not have it in stock, usually they will order it for you and get it for you within 24 hours. Okay, Narcan and naloxone blocks the opioid receptor sites and reverses the toxic effects of the overdose. And again, this medication works for opioid overdoses only. If someone is taken any other drug and are overdosing off of it, naloxone or Narcan will not work for those other drugs. The good news is you can only help someone, you can't hurt them. If you see someone overdosing and you're unsure of what they are overdosing on and you administer naloxone or Narcan and it's not an opioid they're overdosing on, nothing will happen. Just won't help them, but you won't hurt them. Okay, naloxone or Narcan can be administered in 3 different ways: intravenously, intramuscular, or intranasal. Okay, intravenously, you can use in a syringe with the medication, you can inject it into any muscle in their body. And with the auto injector, it kind of reminds me of an EpiPen, same thing. You can hit them in the muscle. It has the retractable needle. And then there's the intranasal spray through their nasal cavity. Okay, so why do we use naloxone Narcan? The nasal spray, we use the nasal spray form because there's very low risk of exposure to blood because no needles are required. It can be administered quickly with very little training, and it's very effective when used. And it's effective for opioid overdoses only. How Narcan and naloxone works. So I talked earlier about someone is taking an opioid and their receptors are blocked by the opioid. When you administer Narcan or naloxone to them, the naloxone, your receptors in your body actually have a stronger affinity for the naloxone or Narcan than it does for the opioids. So the opioids are setting on those receptors, blocking the person from breathing. You administer Narcan or naloxone, it comes into the system and it actually knocks those opioids off the receptors and it sits itself there, replacing those opioids, replacing those receptors with naloxone. to prevent the opioid from being able to come into the receptors. And I will show you a short video on how to administer naloxone or Narcan spray.
Narcan nasal spray is an emergency treatment for a known or suspected opioid overdose. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name.
Kevin.
Ask if he or she is okay.
Hey, Kevin, can you hear me?
Check for signs of an overdose. Seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril. Acute opiate withdrawal symptoms may occur from use of Narcan nasal spray in patients who are opioid dependent. Symptoms include body aches, diarrhea, increased heart rate or tachycardia, fever, runny nose, sneezing, goosebumps, also known as piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness, and increased blood pressure. When the emergency is over, put the Narcan nasal spray back in its box and throw it away in a place that is away from the reach of children. In addition to watching this video, please read the quick start guide that comes with Narcan nasal spray before using it. Talk to a healthcare professional if you have any questions about how to administer Narcan nasal spray. Please read the indications and important safety information that follows. Store Narcan nasal spray at room temperature between 15 to 25 degrees centigrade. Do not freeze Narcan nasal spray. Keep Narcan nasal spray in the box until ready to use. Protect from light. Replace Narcan nasal spray before the expiration date on the box. Keep Narcan nasal spray and all medicines out of the reach of children.
Okay, so after administering naloxone or Narcan, most people generally respond within 2 to 3 minutes. Naloxone will continue to work for 30 to 90 minutes, but after that, overdose symptoms may return and or multiple doses of naloxone may be needed. Again, that is because you don't know what a person has taken or how much they have taken. So there have been reports from one of our local sheriffs in Pulaski County reported to me sometimes last year that they responded to a call and 6 doses had to be administered, but they were able to bring the person back. And also keep in mind that Narcan and naloxone has no overdosing powers itself, so you can basically administer it until it's gone. So if you have to keep administering because they're not responding, you can continue to administer it until you don't have any more. This is why it's so important to first thing you do when responding is call 911, because when the ambulance or police show up, they are equipped with naloxone as well. And so once they're there, you're out of it. Okay, you also might need to continue rescue breathing while waiting for the naloxone to take effect. If you've used all that you have and help has not arrived yet, you may have to continue rescue breathing. Also, a person might exhibit some withdrawal symptoms such as fever, hypertension, agitation, disorientation. Always let the person know what is going on. Even if you don't think that they can hear you, they might be able to hear you. And just by letting them know what's going on, just saying, hey, I think you're overdosing, help is on the way, and that kind of stuff. Okay, also a person might experience some restlessness, nausea, vomiting, abdominal cramping, yawning, sneezing, and body sweats. Always, always, always keep your own safety in mind. Step back after administering naloxone, as the individual may display some agitation, vomiting, or disorientation. Always remember to use a face shield when performing rescue breathing. And I will be delivering to your organization. In addition to your kits, I will also provide face shields. And unless you are a trained first responder, do not touch any pills, powders, or unknown substances or paraphernalia on or around the person experiencing the overdose. Okay, naloxone can be carried like in your glove box of your car, but you would not want to store it there because you don't want it to get too hot or too cold. Naloxone does need to be stored in a temperature controlled environment. Naloxone has a 2-year shelf life, so you want to pay attention to the expiration date on your kit. Also, expired naloxone may still be administered if there are no other choices, okay? If that's all you have. However, it may not be as effective as it may not be as effective if it is expired and a second dose may be required. Also, naloxone can be used in children, pregnant women, and animals. And it will only reverse, again, naloxone will only reverse an overdose resulting from opioid use. Okay, as a recap from today's presentation and training, some things that you do want to do when a person is overdosing. You want to support the person's breathing, performing rescue breathing. You want to administer naloxone. You want to put the person in a recovery position on their side if they are breathing independently, and you want to just stay with the person and just again provide comfort, maybe keep them warm, or again, as I stated earlier, just kind of talking to them and letting them know what's going on. And some things that you do not want to do if someone is overdosing, you do not want to slap or forcefully try and stimulate the person because these things can cause further injury. You want to do things for stimulation like the sternum rub and calling the person's name. You do not want to put the person in a cold bath or shower, as we've seen on TV many times. This increases their risk of falling, drowning, or going into shock. And you also do not want to try to make the person vomit whatever drug they may have swallowed because they can choke. And choking or inhaling vomit into the lungs can also cause a fatal injury. And on the screen, you will see our overdose prevention program. We ask that if you have to administer naloxone, that you complete this form and return it to us within 5 business days of administering. You can also turn it into your manager, and she can contact me, and I will pick those forms up or arrange for a way for her to get those to us. These forms are extremely important, this data, because it's the state's tool to collect data on the crisis so that they can understand what's happening in our counties and how much assistance that we continue to need with regards to receiving resources, free resources for your counties, such as free naloxone or Narcan. Okay. Yeah. And also now there is also an app called Narcan Now. Most of us have smartphones these days. You can download this app onto your smartphone, and it basically will go through the things that I went through today. It just gives you a quick overview of what we've done today, and in showing you how to administer naloxone or Narcan if you may have forgotten some things or something like that. It's a pretty handy tool, actually. And that will complete our training for today. And I appreciate you attending this training. I appreciate each and every one of you for being the person in your communities who are with this pandemic. Many of you are out here working, called essential workers. If you're working now, then you are always essential. And again, we do appreciate your work in our communities. If anyone has any questions, I can be reached via email at mhalton, that's M and then HALTON at Egyptian.org. Again, that's mhalton at Egyptian.org, or I can be reached by phone at 618-313-0916. That's 618-313-0916. I will be dropping the kits off to your agency soon. Again, thank you and have a great day.